Welcome everybody to a webinar put on to you by the SAN Maternity Department. Thank you for joining us. Hopefully there won't be too many technical problems as we get through it tonight. And I'll just go through a few housekeeping rules and introduce our speakers to you shortly. Firstly, my name's Peter Wood. I'm one of the obstetricians here. I've been here for 11 years and luckily I've delivered approximately 2,000 babies here at the SAN, and it's been a great privilege helping those mums and really helping families start their family life. It's been great, and I really enjoy working at the SAN. Particularly the staff here are so experienced, and they really have an edge that it's hard to put words to, but they bring a lot of experience and love to looking after all their mums here, and they take their job very seriously. And one of the things we've noticed here at the SAN over the last few years that people, staff members, particularly the midwives, they don't leave the SAN, they tend to just retire. So there's quite a number of midwives who have been working here for ages. There's even one in her 70s who refuses to leave because she just enjoys working here so much. So that just pretty much sums up how good the staff are here, and it's a real privilege to work with them. Basically, the agenda for tonight's program, I'll just go through some boring housekeeping rules first, and then I'll be introducing our speakers to you. Firstly will be Dr. Ellie Bailey, one of our new obstetricians, and she'll talk to you about why it's important to have private health cover and why private care during your maternity time is very good. Then we'll have a talk from Melissa Grant, who's one of the co-founders of the antenatal program Nourish, which is accessed through the SAN website. Then we'll have the head of paediatrics here, Dr. Neil Ginsberg. He'll be talking to us about some do's and don'ts when accessing Dr. Google, and particularly at this time when we're all stuck at home during the social isolation. Dr. Google's probably been flogged a fair bit. And lastly, I'll talk to you a bit about the new Swaddle program here at the SAN, or the SAN Baby Bundle. And then finally, we'll have a Q&A session, and then we'll also have an extra speaker there, Dr. Katia Zubrin, who's a psychiatrist here at the SAN. Just a couple of housekeeping rules. Your microphone and video will be turned off by default. And when we have the Q&A session, that will take place at the end of all the presentations. You should put your questions and type them into the Q&A part on the actual side screen there on the Zoom program. It's fairly intuitive. We'll basically answer the questions in order they're received, unless of course a question has been doubled up or is a similar question. We'll try and cover it all and to be more efficient. The controls for Zoom are fairly intuitive, and it's also important to note that this webinar is being recorded. Just a little background of the SAN, for most of you probably know, but some of you may be new. The SAN's been around in this Wahroonga area for more than 100 years. It basically is now called the Sydney Adventist Hospital, but the reason it's called the SAN now is because it used to be called the Sydney Sanitarium, and I'm sure you're familiar with the breakfast cereal or the food group Sanitarium. It's all connected to the same group, and they all started here together. Then they've all sort of gone their own ways, still connected emotionally, I suppose. But the SAN Hospital, the Sydney Sanitarium, became the Sydney Adventist Hospital a few decades ago, but everyone still refers to it as the SAN. And you know, when you're a SAN baby, that's what you are, and people know exactly what you mean. The first baby was born here in 1903 in this little tiny house there on the right-hand side of your screen, which is still there to today. You can see it from the birthing unit. That's where our first SAN baby was born. And nowadays we deliver approximately 2,000 babies a year, and it's been just a real privilege working here and being a part of that process. To us here at the SAN, it's more than just you having your baby and going home. We like to just think that we provide a great start to your baby's life. You get the wonderful care of the midwives. We've got excellent lactation consultants here. The paediatricians also just provide, I think, above and beyond care for you and your baby at this special time when you're learning about, you know, first-time mums and first-time dads, how to look after your baby and how to breastfeed and all those other stuff that doesn't necessarily come easily to all people. And the staff here, I think, is really what makes the SAN baby experience just so special, because a lot of the staff, as I said before, have just been here for so long. And really, it's more than just a job that they go home from. They really get involved in your care and take everything to heart. I really find working here very special. And one of the other great things working here is it's just part of a really big hospital, and we have a lot of access to other resources. We've got a fantastic intensive care unit, should you need it, hopefully not, but we have been on occasions, unexpected moments can happen. We've also got, you know, access to other specialists should other problems arise, and being part of this very large private hospital does provide really world-class and first-class treatment and care. Every year we have a teddy bears picnic, which we didn't have this year, unfortunately, because of the coronavirus pandemic. But every year out in the front lawn of the hospital in May, usually just the Tuesday before Mother's Day, we have this teddy bears picnic where we invite mums who've had babies in the last couple of years to come and reunite with their obstetricians and midwives. And it's a really special time. I mean, I go there and lots of mums come and give you a hug and show you their 2-year-old child, or show you their, you know, and sometimes it might be several generations of children delivered, and it might be their 4th baby, and you see all the kids there because there's play gyms and other equipment for the kids to play on, and it's really a great time. And we have some entertainment as well. But so that's, you know, a special part of the annual calendar here at the SAN, and we value that time very well. And a lot of especially if babies were born a bit preemie or have spent some time in the nursery, when the nursery midwives can come down and meet you and just come and see how your baby's growing. It's very good for us because we just see that you're making it and you're surviving and that you're doing life well. And it's nice for you to, you know, for the mums to catch up with their carers. All right, our first speaker tonight is Dr. Ellie Bailey. She's one of the new obstetricians here, and she brings a great wealth of experience with her. And we just ask you to spend some time with Ellie now. Over to you, Ellie.
Hi, good evening everyone, and thank you, Peter. My name's Ellie Bailey. I'm one of the obstetricians at the SAN, and just giving you a little talk tonight about why you might consider having your baby privately at the SAN hospital. So just a little bit about me for a start. I'm obviously an obstetrician, but I'm also a mother of 2. I've got 2 little kids called Hugo and Felicity. As you can tell from my accent, I'm English. I trained in the UK, but then followed my Australian hubby out to Sydney, which was probably the best thing I ever did. I'm very, very happy and settled in Sydney. I did my training at Royal North Shore Hospital and the hospitals that surround it, so Gosford and Hornsby, and I absolutely adore my job. Lots of people say, could you do anything else? Did you pick the right specialty? Especially when you're very sleep deprived from being up from a birth, and the answer, hands down, is always yes. I love being with the women during their pregnancies and births. No pregnancy is ever the same, even for the same woman having subsequent babies. Every pregnancy is different, every birth is different, and it really keeps you on your toes. I love seeing women back for their future babies and just building that relationship with them and their families as their families grow. I also adore that you can see women once they finish having their babies and follow them through for their gynecological concerns, so their heavy periods or their fibroids or their prolapse or their menopausal symptoms, and really just get to help women through all stages of their life. Being a mother of 2, I'm sure lots of you understand, I'm very used to being woken up by the children, but also being woken up for births. But actually, I really don't mind, and I really do quite enjoy going out into the night and coming back and saying to my husband, "Yeah, we had a little boy, or we had a little girl." It's a really special job that I get to do. Lots of people wonder why you might consider actually having your own personal obstetrician. It's really special and important, I believe, to have a trained specialist looking after you that you trust, that you have a relationship with and a rapport with. They are a highly trained person who's done many, many years of training, who is your expert by your side during the whole pregnancy and the birth. You see each other from sort of 8 to 10 weeks pregnant for the whole of your pregnancy. So you have over 30 weeks during which you build up a relationship with each other. They get to know what's important to you. They get to understand what's important for you for the birth, and will bend over backwards to make that a reality for you. It also means that should anything go awry during the pregnancy or the birth, that you have someone by your side that you trust, who understands you, who is going to look after you and your baby, as opposed to a stranger rushing in that you've never met before, who's suggesting that you go to the operating theatre, or that you have some intervention that you've never discussed with them before. And that's really nice in those moments when you're anxious and you're nervous, to have someone that you trust, that you say, sure, I trust you, whatever you think, let's do it. Having an obstetrician also means that you have someone that you can call with your concerns and your questions. They are essentially available to you 24/7, so that if you have any worries, if there's any bleeding or any pain or concerns, that you know that someone's got your back and someone's going to be making sure that you and your baby are just fine. If you choose to have a private obstetrician, you normally have your first appointment at around 8 to 10 weeks. We can see you earlier if you have any concerns, so if you have bleeding or pain, or a particularly high risk for any reason, certainly can see you earlier, but standard would be about 8 to 10 weeks. We then normally see you about 4 weekly until you get to about 28 weeks, and then it goes to fortnightly, and then weekly from 36 weeks until your baby arrives. During an antenatal visit, we obviously do all the routine things that you would have done in a public midwife clinic or public hospital doctor's clinic, but you also will have often a bedside ultrasound by the obstetrician, just to make sure that all is well with your baby. So to check baby's position, the heartbeat, the fluid around the baby, and sometimes we might do the baby's weight as well, just to get an idea of how baby's growing. We monitor you really closely, obviously making sure that the pregnancy is progressing well, and it gives an option for us to let you know if we think anything's going awry, and you can obviously discuss with us any concerns that you have. Because we see each other so often, I often find by the end of pregnancy, it's as if we have a friendship, a good friendship, and often we're quite sad after the 6-week postnatal check to say goodbye to each other. And I often secretly hope that people are going to hurry up and get preggers and come back and see me again, so that we can continue our relationship. When you think the baby's coming, say your waters have broken or your contractions have started, normally you or your partner will ring up the SAN birthing unit, and the number is normally on the bottom of your pregnancy antenatal card. On the end of that telephone will be a really experienced professional midwife, who will talk through what's happening and guide you as to what to do. Sometimes the midwife might suggest it's a bit early and you need to stay at home, or they might give you some advice for what to do whilst at home, but the majority of the time they will suggest that you come in and get checked out. They will also liaise with your obstetrician to let them know that you're coming in, and we will often then meet you there depending on the situation. Once you're on the birthing unit having your baby, your obstetrician will absolutely strive to give you the birth experience that you are after, whether it is a very natural birth with very little intervention, or the opposite. We will bend over backwards to work hard to make sure that you and your baby are safe and well, and that you have the wonderful birth experience that you deserve and that we're striving towards. The birthing unit is on the top level of the Clark Tower in the SAN, which gives you absolutely phenomenal views of the Upper North Shore. The rooms are divine. Each room is a personal room with an ensuite, obviously. It's got electric beds so that you can labour in different positions, so you can be on all fours or standing up, leaning over the bed. Each room also has a bath and a shower, so you can use that for pain relief, certainly in the early stages or throughout the labour if you wish. 2 of the rooms actually have dedicated birthing pools for water births, so that's definitely an option for those that want water births. We've got all the things that you might want in labour: birthing chair, birthing balls, aromatherapy burners, microwaves for your heat packs, and ice machines, so that your partner can run around and get all the things that you're screaming at him that you want. And for those that might want an epidural, you can rest assured that there's a consultant anaesthetist never far away who can do a very quick, very safe epidural for you if that's what you want. And there's often hardly any delay in getting an epidural, which for some people is a godsend. This is just a picture of one of the birthing suites. As you can see, there's a bath in the room and the electric beds, and absolutely gorgeous views over Warringah and the surrounds. During your birth, obviously, hopefully you're there, your partner. Pre-COVID times, there would also often be patients' mums or a friend, or some people might employ a doula, who's another specialist birth attendant, to be with them if they want to. Your obstetrician, and also your midwife during the birth. So you will be allocated a midwife when you come in labour. The awesome thing about the SAN is, because it's such a big private hospital, I think it's the biggest in New South Wales, there's an absolute plethora of very experienced staff available to you should anything go awry. So we have anaesthetists, surgeons, operating theatres, an intensive care unit, paediatricians, so that you know you are in the safest hands when you give birth. Best case scenario, you don't need anyone else involved, but if you do, you're in really, really safe hands. When your baby's born, we absolutely prioritise skin to skin, so babies go straight onto mum's chests unless there's a concern with baby that means we can't. And also we really prioritise getting breastfeeding started early, so you can rest assured that the midwives, presuming that's what you want, will be helping you straight away as soon as it's feasible to give Bubby their first feed. Once you've been washed and showered after the birth, we normally get you down to the maternity ward, which is on the level beneath the birthing unit, and has the second best views of the surrounds. And most people tend to stay for 4 to 5 days. Again, everybody has their private suite. Many of the rooms have double beds, or certainly day beds, so your partner can stay, which I think is really important, especially in those early days when you're getting to grips with how to manage your new baby. To have your partner by your side is a massive bonus. The rooms all have their own ensuite. They have a baby bath, they've got a fridge, so you can keep your snacks in there. They've got a TV with Foxtel, and there's also complimentary Wi-Fi for everyone to use. During your 4 or 5 days there, you'll have a visit from your obstetrician every day. There'll also be a specialist paediatrician who'll come and do your baby check in to check up and make sure baby is perfect. There'll also be the hearing test done. And very importantly, there's the lactation consultants who are available on the ward. These are the specialists who help you to establish feeding. They help to make sure you've got a good latch. They take the time to sit with you and really focus on getting your feeding sorted before you go home. Obviously all your meals are supplied on the ward, and they're forever bringing around cups of teas and cake and stuff, so you 100% will not go hungry. Whilst you're on the ward, there's a whole timetable of activities that you can go to if you want to. If you don't want to, that's totally fine as well, but there's options for activities, and they're really, really good. So they're mostly run by the ward midwives, but there's also physiotherapists as well, but they teach you about how to settle your newborn baby, lots of lessons on breastfeeding. There's also a physio who comes and does pelvic floor exercise training and how to get in and out of bed, and how to aid your recovery. And also there's lessons on how to bath your baby, which is always absolutely gorgeous. They put a lot of effort into helping you and guiding you on those first days when you often feel a bit overwhelmed and exhausted and tired. They really, really do stand by you, help you, guide you as you learn how to become a mum. This is an example of one of the maternity bedrooms. That green chair in the corner is one of the specially designed breastfeeding chairs. It was made specifically that you've got armrests so that you can hold your baby more easily, so that you're in a better position to comfortably learn to feed your bub. One of the advantages of a private hospital over a public is the option of using the well baby nursery. So this is not for poorly babies, this is for the well babies. It's just so that you can get a bit of time out. So what can happen if you want to is it's on the maternity ward, is the baby can actually go down and have some time with one of the midwives down in the Well Baby nursery, just while you catch up on some sleep overnight. So some people, when they're getting exhausted on day 2, day 3, will let the midwives look after the baby for you between your feeds, just so that you can get some undisturbed rest, which is so important for your recovery and for getting your milk in. Getting those few hours of uninterrupted sleep are really, really, really important. And you know that your baby's being looked after by a specialist who knows exactly what they're doing, and they will bring your baby straight back to you when it's due for a feed, and you are completely in control of what's happening with your bubby. But lots of people take advantage of this, and I think it's a massive benefit in helping you to recover and get some rest. There's also the special care nursery, which is for babies that are unwell for some reason. It is a high dependency unit which is staffed by consultant paediatricians and neonatal nurses, and babies might need to go there if they are born early, or they are low birth weight, or they're unwell for some reason, for example an infection or difficulty breathing, something like that. You can rest assured that your baby is really, really well cared for by top-notch staff, and will be in the best of hands. This screen just gives you just a little overview, just things to remember with private care. Obviously you have your own dedicated obstetrician who knows you, who understands your pregnancy, your birth, and will advocate for you in the best possible way. You get to stay 4 nights after a natural birth or 5 nights after a cesarean birth, so that you really have time to recover and to be guided in how to become a mum, how to feed, how to settle, how to bath, how to do all those things that you might not get if you are in the public hospital, where you might get discharged, 24 hours after delivery, or sometimes even earlier. You've got midwives on hand 24/7. You've got lactation consultants to help you with feeding, and there's the option to use the Well Baby nursery overnight so you can get some rest. Your partner can stay with you, which is a massive bonus, and almost everybody takes up that option, and it really is good for building that family bonding in those first early days. And then you've got the daily education classes just to reinforce your knowledge and to build your confidence so that you're ready to go home. The SAN is, obviously I'm slightly biased, but I did also have my 2 babies at the SAN before I worked there. Is a superb hospital where they really pride themselves on giving you really good care. They want to turn you into good mothers, and they really want to guide you on that journey. You've got really good 24/7 support, and they want to nurture and look after you and your family. And they've got their great reputation, which they've worked really hard in maintaining, so you know that you will be their priority. So check us out at the SAN and have a good look at the Swaddle program too. Thanks, nice to speak to you all.
Thanks very much, Ellie. That was a great talk. And I'll ask you now to spend some time with Melissa Grant, who's the co-founder of the Nourish Baby program. This is a program that the SAN has accessed, and you'll be able to access it through the SAN website. Thanks, Melissa.
Thanks for the introduction, Peter. It's a real pleasure to be here this evening speaking with you all. So before we get started, just a little bit about me. I'm a mother of 2. I'm the founder and co-director of Nourish Baby Online. I'm a Circle of Security parenting educator, and I'm a former Ruby breastfeeding support volunteer. So I provided for 2 years breastfeeding support to first-time mothers. So I'm just really passionate about supporting parents through pregnancy, birth and beyond. So Nourish Baby Online, we're Australia's leading provider of online antenatal and early parenting education. We were established in 2012, and we're the only online provider who is accredited with the Childbirth and Parenting Educators of Australia and the Australian Council of Healthcare Standards. So I guess one of the big questions that we hear a lot is antenatal education necessary? And, we absolutely get it. Getting to classes, time and access is often a real issue for parents, and even more so in today's world with the pandemic. But what we do know is that research really tells us that the information that we, I guess, we are able to gather during that education process, the information around pregnancy, birth and early days with baby really does help inform and help us make, I guess, decisions, more informed decisions and choices during that time. So I guess it's the awareness and understanding that comes with the education that just allows, parents to feel more prepared going into that experience and feel like they're not making decisions on the fly. So we really do encourage you, and as the research suggests, that you absolutely get your antenatal education ahead of time. We also know that it has been shown to improve physical and mental health, because I guess, a sense of uncertainty when you're not prepared for something and you don't necessarily know what is going to come can increase the levels of anxiety. So with that preparedness, we then know that you are going to be feeling more capable and confident going into that experience. So Nourish Baby Online, we understand that, onlining can be boring. So we've invested a lot of time and energy over the years that we have been around into making our platform really engaging. And also, making sure that for people that have different learning styles, when you prefer to learn visually, you prefer to listen to something, you prefer to watch something, we're really catering for all of those, different styles of learning. So all of our features, really make sure that the experience is engaging. The other important thing to note is that as a SAN maternity patient, you receive free access to our classes, which is a wonderful benefit. The other thing that we know can be overwhelming when it comes to education is there is a lot of information that we haven't been exposed to before. And so it can be a case of not really knowing where to start. So we make that really simple for you by asking you to give us your expected due date. We can then provide you with relevant information and information that is specific to a particular course and module. So wherever you are in your parenting journey, we will provide you with specific information in just the right amount to make sure that you can really feel comfortable with what you are learning and not feel overwhelmed by the overabundance of information. We also have our core videos in 3 different languages, 3 different other languages, so Arabic, Mandarin and Vietnamese, and in English with English subtitles as well, so for the hearing impaired and for people that just prefer to, I guess, watch a video with subtitles. We understand that is important too. We also know that, everybody is unique. Every pregnancy, every baby is unique, and everyone has a different parenting style. So our philosophy is really around providing you with the information that can, really help you make, informed choices based on your own unique needs. And what we do to, I guess, complement the health professional education that's presented in the courses is we include parent story videos where you'll hear from real parents sharing their own experiences and perspective of pregnancy, birth and those early days with baby. So just quickly, I just wanted to, run through a couple of, details in terms of what's included in each of our antenatal courses. So there are 3 comprehensive courses, which are included in the antenatal bundle. They each take you about sort of 2 to 3 hours to complete if you were going to complete them from start to finish. So we start with the Guide to Healthy Pregnancy, and that really covers everything that you would expect around, changes that are happening to you and your baby, things like diet, nutrition. We have instructor-led fitness classes, which are obviously catered to where you are in your pregnancy, which trimester, so suitable for which trimester that you're in. We have things, that cover the physical and emotional preparation for labour and birth. For dads, and as I mentioned, those parent story videos too. So labour and birth, we cover everything from how to prepare for labour and birth, signs, symptoms, obviously pain relief, birth complications including caesarean birth and whether that's a planned or unplanned caesarean birth. Understanding the recovery process, which can, sometimes be overlooked. There's a lot of focus on labour and pain relief, but, what you need to take into consideration in that recovery phase, and I'll touch more on that shortly. How to nurture your emotional well-being, tips for preparing for parenthood. What does that look like, and how can you feel, confident going into that big change? And again, those real parent story videos. And our feeding course, so everything from getting started, starting to recognise babies, cues in terms of hungry cues, what to look for in terms of, how am I latching my baby correctly? There are step-by-step guides, lots of videos, how long, how often to feed my baby. We do cover formula feeding as well, mixed feeding, and then we go all the way through to the introduction of solids. So again, we have often a question around when should I start? And I guess the benefit of our online classes is you can really start as early as you like. There's lots of relevant information on diet and exercise for the very beginning of your pregnancy all the way through. As I mentioned, those instructor-led fitness classes may be of interest to people. But I guess the number one benefit is that you can learn at your own pace and in your own time, and you can refer back to the information as often as you need. So, don't feel like you need to be overwhelmed by everything all at once. I mentioned the 2 to 3 hour duration of the courses, but you don't need to sit down and watch 2 to 3 hours all in one hit. You can take it in chunks. You can go back over the information. It is really helpful for parents. So now I really wanted to move on to, I guess, some common questions that we hear from parents. So I'm going to start with some common questions, and then I'm going to follow up with, I guess, some less common questions, but, things to be, I guess, considerate of going into your parenting experience. And I'm just going to talk about them in terms of stages. So I'm going to start with pregnancy health. And, the number one question we're often asked is it safe? And while, I guess, common sense tends to prevail with things like nutrition and what we should be avoiding, something to be aware of is to avoid particularly, medications that you don't need to be taking during pregnancy. And even those medications that, may be so-called natural or herbal, it's really important that you avoid those, or at the very least you check in with your primary caregiver to get the okay first. And that same should be said for things like exercise, particularly if you haven't been exercising leading up to your pregnancy. So always just check in with your primary caregiver. When will I feel my baby move? And this is a really exciting milestone in pregnancy. So generally between 16 to 24 weeks, we start to feel baby moving. And as you would expect, as baby grows, that movements become more obvious. And it is a really exciting time. The other thing that babies' movements tell us is how they're developing, their health and their well-being as they're growing. So what's really important is if you do feel any change, where you feel no movement, a change in movement, that you get checked immediately, because it is a real sign of how baby is generally doing. So it is really important to get checked out if that changes. Why can't I sleep on my back? So, many of you probably know the answer to this, but, for those of you who don't, from 28 weeks of pregnancy, the recommendation is to be sleeping on your side. And the reason is that the growing weight of your baby places increased pressure on a major blood vessel, which can reduce the blood and oxygen being flowing back into the uterus and to your baby. And it's also been shown to have a potential risk or impact on stillbirth. So what we also suggest is that just get into the habit really early of sleeping on your side. So if you're starting to do it even when baby's teeny tiny and there is no large pressure on your tummy or on your uterus and lying on your back, just get into the habit of sleeping on your side early so it just becomes second nature. So labour and birth, pain relief, and that's always, I guess, a big question for parents around what are my options for pain relief. And while, there are a range of both non-medical, so things like breathing techniques or a TENS machine, you may have heard of that, and there's lots of medical pain relief options. I'm not going to go into every single one here. We do have a really comprehensive module in our labour and birth course on pain relief, but I just encourage you to go through each and every one of those options and just really familiarise yourself with each of the options so that you can make an informed choice on what will work for you. So we cover all of the options. We also talk about the impact on mother and baby for each of those options. When to call the hospital or head into the hospital. So again, something that's often top of mind. And the short answer is, you can call the hospital at any time. If you have any questions at all, whether you're concerned or you just have a question, the midwives are there for you 24/7. and we'll happily take a call and answer any queries that you have, as will your primary caregiver. What really makes sense too is if you feel like you're going into labour, again, give the hospital a call, because they can talk you through understanding where you're at in your labour, and they can give you suggestions on what you should be doing next and when you should be heading in. The other important thing, I guess, to take into consideration is just map out your journey. Think about where you need to park, where you need to enter the hospital. So those are the sorts of things that you can prepare, I guess, ahead of time, so that you don't feel like, you know, it's panic stations when it comes to actually heading in and knowing where to go. What if things don't go to plan? And I guess, you know, the number one thing to take into consideration here is that pregnancy, labour and birth are very unpredictable. No two women will birth in the same way. So it's really important just to think about, during your pregnancy and the lead up to labour and birth, think about all the various different scenarios and how you'd like to address those if they did arise, so that you're not feeling like you're making decisions that you haven't necessarily considered. The other important thing to know is that your caregivers will keep you very well informed during your labour and birth. The decision is always yours and yours to make. And also know that it is perfectly acceptable to change your mind. If you go into your labour and birth with a preconceived idea of how you'd like things to play out, and you get into that situation and feel like you want to go down a different path, it's absolutely acceptable. And you know, just be encouraged to think about all the options and know that you can change your mind. So breastfeeding, how often and how long to feed my baby? And again, like many things, the shorter answer is it really varies. It will vary from baby to baby, and will vary from week to week and potentially day to day, particularly in the very early days. A newborn's stomach is tiny, so as you can imagine would need really frequent refilling, and so it's really normal for a newborn to be feeding anywhere between 8 to 12 times in 24 hours. So what's more important and what you will learn to do, you can certainly watch our breastfeeding videos to start learning what some of those cues look like. It's important for you to get to know your little one and their individual needs and their individual cues on how often to feed them. It's not about watching the clock. And the same goes for how long to feed my baby. Generally, your baby will let you know when they've had enough. You know, their feeding, their sucking will really slow down. They might fall off the breast. What I find is often helpful for parents to think about in this phase is think about how your feeding or your hunger changes on a day-to-day basis, and that can really be influenced by how active you've been, you know, how much sleep you've had, and babies are just the same. They don't necessarily want a 3-course meal every time they sit down for a feed. So just really be aware of that and just learn to cue into your individual baby's needs. How do I know if my baby's latched correctly? Well, obviously the midwives in hospital will very much help you with those first few feeds. We also have, as I mentioned, some wonderful step-by-step guides to attaching baby to breast. But breastfeeding isn't meant to hurt. So if you're finding that breastfeeding is very painful, it's really important that you seek assistance early. So the hospital is always a great place to start, but there's other resources obviously available where you can go and get assistance if you feel things just aren't working for you. Don't ever be afraid to ask for assistance. There's lots of support available. And how do I know if my baby's getting enough? Well, unfortunately, we don't have gauges on our breasts that tell us that, you know, how much milk baby is taking, but generally we know that once your milk comes in, at the end of a feed, your breast will generally feel a lot softer and well drained. And so that's generally a good indication that your baby is getting enough. The other way to check if your baby is getting enough milk is to check their nappies. So we want to see between 4 to 5 heavily wet nappies or 6 to 8 cloth nappies in about 24 hours. And there'll be lots of little poos throughout, you know, those first 4 to 6 weeks, which will look a little bit like seeded mustard. So that's always a good sign. Now I wanted to touch on, as I mentioned, some of those, I guess, less common but equally as important questions that, you know, are just good to take into consideration ahead of time. And the first one is that, I guess, preparation for parenthood. We spend a lot of time, you know, thinking about the physical changes that are happening with us and our baby during pregnancy, but it can really help to start thinking about how life is going to be once baby arrives. So as, you know, with any big change and experience, it, you know, can make the transition a lot easier to how things are going to be different if we start thinking about things ahead of time. So what is a good idea is to start thinking about your own experiences of how you were parented, how your partner was parented, and have a discussion around what elements you'd like to incorporate into your own parenting style. And that can be really helpful for parents to start thinking about. The other one that's somewhat related is your emotional health, both you know, in the antenatal phase and after baby is born. We know that, you know, becoming a mother, a father, a parent for the first time is a huge milestone. But with, you know, any big change and transition, that can be, you know, bring a whole wealth of different emotions. And whilst some of us may feel every end of the spectrum in terms of emotions, which is really normal, for some people, those psychological changes can place them at increased risk of anxiety, stress, or depression. So whilst we, you know, absolutely expect to see some ranges of emotions, some times of increased stress and anxiety in parenthood, if those, I guess, stretches of feeling really down go for an extended period, either for yourself or for your partner, because we know that, you know, dads and partners can experience perinatal anxiety and depression as well. It's really important that you seek assistance and seek assistance early. Don't ever, particularly in the antenatal phase, don't ever feel like the, you know, the periods of extended feeling down is just related to hormones. It certainly could be something more. So really seek help early in that phase. The other one that I wanted to talk about, which I think people are very aware of during the pregnancy phase, but not necessarily in the recovery phase, is the importance of your pelvic health. So as you know, the increased weight of your baby does start to really impact the pelvic area and the pelvic organs. So that's why we spend a lot of time strengthening the pelvic floor muscles in the pregnancy phase, both for, you know, supporting the weight of your growing baby and to see you through labour and birth. And the hormone relaxin also contributes to that, so it, you know, can compromise the strength of the pelvic health muscles. So it's really important that, one, we strengthen, but we also reduce any excess strain on those pelvic floor muscles. So that's why things like, you know, high impact exercise should really be avoided in the pregnancy phase. After baby's born is often a time that, whilst we're tired and exhausted, we tend to feel like we should be getting up and about and out and about with our baby. But what's really important is that we spend the time slowly recovering and slowly allowing those pelvic floor muscles to recover from, obviously, the 9 months of carrying baby, and also for that period of time where you're going through labour. So if possible, you know, try and avoid being on your feet in those early weeks for more than 15 minutes at a time, and try and lie down as much as possible to just really allow your body to repair and recover. Now, we touched on the frequency and duration of feeds a little earlier, but I think I just wanted to highlight it again because it is often something that, you know, mums are generally surprised at how often their babies feed. We talked about tummies being really tiny. Breast milk's also really easily digested. So not only is it normal for feeding to be frequent, both day and night, it's really necessary for them to be fueled. But know that as your baby matures, their stomach obviously capacity grows and they just become more efficient at feeding. So that sort of, you know, frequency and duration does tend to reduce. There's really sort of no hard and fast rules in terms of timing. It really comes back to tuning into your own little one's unique needs. And finally, I just really wanted to, I guess, end on the importance of seeking help early if things arise, and really before things spiral out of control. There's lots of spectrums of normal, and that's a wonderful thing, but don't ever feel like you need to battle through something that is difficult, or a challenge that you feel isn't right, because there's lots of wonderful support out there to assist, and lots of people that want to help you, have a really wonderful experience in this parenting journey. So obviously your obstetrician, your doctor, your midwives, the hospital where you have your baby, they're all really great sources of support, and everywhere to family and friends. So just think about perhaps in your pregnancy stage who those wonderful support networks are. Sometimes when we talk about breastfeeding, we just talk about having potentially a friend who's breastfed, people that you can call on for support. So just make sure that you really tap into those sources. So that's it for me. So look forward to taking any questions at the end, but really appreciate everybody listening in. Thank you.
Thanks, Melissa, for that information. And I'll now hand you over to our Head of Paediatrics here at the SAN, Dr. Neil Ginsberg, who will talk to you about basically how to use Dr. Google responsibly. So thanks, Neil.
Thank you, Peter. And thank you to everyone for joining us this evening and giving me the opportunity to talk to you about a topic which sounds lighthearted, the Dr. Google don'ts, but I think ends up being a very serious and important topic, particularly for prospective new parents. Is caring for your newborn an art or a science? Well, the truth is that it probably is a little bit of both, but I think there's a lot more of an art to caring for your newborn than there is a science. And this is what I'm going to focus on in tonight's discussion. In particular, we're going to focus on caring for a newborn in the age of Google, social media in general, Facebook, sites like North Shore Mums and other similar sites, input from things like Mamma Mia, and then general societal pressures, the burden of trying to live a healthy lifestyle, and the importance of obviously trying to raise successful children and the pressures that come with that. So just by way of an example, and I have to say a very common example of a new mum who comes to see me with a 2-week-old baby because she's having difficulty settling her bub. She tells me that the baby's crying and very irritable, and she feels that this is excessive. She particularly talks about this occurring in the evenings, maybe between about 4 and 9 p.m. at night. The baby arches her back, goes red in the face, and she's unable to console her baby. In this situation, I'm often told that the baby has one of the following problems. My baby is in pain, my baby has wind, my baby has reflux, or my baby is constipated. And to be honest, in a lot of instances, I'm told all 4 of those things. So as doctors, we then put together our amazing diagnostic skills to try and work out what's preceded the events of mum making this appointment. And that's where Google comes in. And what's mum done during this period of time? Unsettled 2-week-old baby goes into the search engine. And what's the first thing that pops up? And this is a genuine search result. This comes from the Royal Children's Hospital in Melbourne, and a link to something that says Kids Health Info, crying and unsettled babies, colic. Well, she doesn't have to read any further. There's a name for her baby's problem. Her baby has colic. Now she's got to proceed further. What is colic? She's got to find that out. So into the search engine goes colic, and the results come in severe pain in the abdomen caused by wind or obstruction in the intestines, and suffered especially by babies. 2 words stand out there: severe and pain. So she now already knows her baby has colic. This is a severe problem and her baby is in pain. So she needs to look for the causes of colic. And there's a multitude of web references. But if you look on the bottom of the slide, this could be an allergic reaction, acid reflux, overstimulation, gas-producing foods, air intake from feeding or crying, and an immature digestive and nervous system, a multitude of problems that can be affecting her baby. She needs to find what the treatments are. And fortunately, the moment she types in treatments of colic, therein comes a multitude of different products that are available that can help her baby improve. There's even a website that reviews these and gives the best relief for gassy babies. There's a site called Babylist that gives her the 6 best of every one of these different products that she can help guide herself through what she's going to do for her poor little bub. And there's millions of books. There's the Colic Baby, Natural Ways to Soothe Your Crying Baby, the Colic Manual, 30 Ways to Soothe a Baby with Colic, Tried and True Tips. And then Love in the Time of Colic, the New Parent's Guide to Getting It On Again. Well, that's not on her priority list at the moment, but clearly it's important to the point that somebody's even written a book about it. And then she comes across another means of helping her baby massage techniques for colic and for constipation. Now that sounds appealing because it doesn't involve using medication, and she types in baby massage. And once she types in baby massage, numerous websites come up that give her options to take her baby for a massage. That's A to C I've only put onto that slide. What about D to Z of places that will help her baby with massage? Chiropractic for Babies offers back to basic chiropractic for babies and obviously massage help. She then looks up chiropractic and says there's 10 signs your newborn needs an adjustment. Chiropractic adjustments for children, 95% have malalignments, and chiropractic can relieve this. So let's stop there for a moment and analyze what's happened. So within a few mere moments of starting to look on Google, what has this new mum established about her baby? My baby has colic and it's clearly causing severe pain. This is obviously a real problem. Why does she know this? Because there are many, many treatments available. So if there are treatments, it has to be a problem. There's natural therapies, there's pharmaceuticals, there's massage, there's chiropractic. This leaves her very stressed and incredibly confused. What does she do in this instance? Well, thankfully, she makes a very sensible call and rings her mum. But whilst she's waiting for mum to arrive, she just suddenly thinks to herself, you know, in these days, you better check what's the impact of coronavirus on babies. And lo and behold, of course, you find a reference to a 2-month-old baby who developed COVID-19. So she starts to wonder, could that be her baby's problem? Fortunately, mum comes along, and as is almost always the case, sensible, comforting mum is able there to help her. And I think this is a typical scene that one would see in many suburban homes in the first few weeks of a mum taking home a new baby. And sensible mum comes up with an extremely sensible suggestion and helps her daughter to make an appointment to see the pediatrician. So let's talk about a few facts that happen with newborn babies. First of all newborns cry. Now, whilst this might come as no surprise to everybody, I think it comes as a major surprise to new parents when they realize the extent to which babies do cry, and particularly right from the very beginning. First few days, even in their hospital stay, babies are extremely unsettled as they learn to cope with being out in the big wide world, and more important, as they learn how to demand feeds and make sure their tummies are ultimately full. This crying peaks at somewhere round about the 6 to 8 week mark, and most often, but not always, recedes by about 4 or 6 months. Now, easy for me to say, probably with you guys listening out there, it doesn't sound too onerous, but if you've got an unsettled baby and you've got to deal with that unsettledness for almost half a year, it's extraordinarily taxing, particularly the late afternoons or the evenings or the troublesome times, and often clusters with hours of inconsolable crying. There's no evidence to support the use of any of the treatments that I've shown you in the slides above. Herbal treatments don't work, the various baby colic remedies don't work, acupuncture, manipulation have no role to play in dealing with an unsettled baby. Multiple formula changes in those babies that are not breastfed are tried by lots of parents, and it makes no difference. The only thing that has been shown to have some benefit is probiotics, and even that is somewhat controversial, but there will be more studies to come out to help guide us as to whether this is beneficial. There are, however, some excellent websites. There's some excellent resources out there. The top one that I've put on my reference list there, Purple Crying, is an excellent website that pretty much describes to you what this difficult phase is all about, and that in fact it's not because there's anything wrong with your baby. There's Raising Children, Tracillian, and the Lactation Consultant's website, all of which can be extremely helpful in getting you through what's an amazingly joyous time, but at the same time a very taxing and difficult time. This is a narrative that I think helps understand what goes on with some parents. And I think it also highlights the fact that this is not something that can be put completely at the blame and at the feet of the parents who are going through it, but I think the medical system sometimes perpetuates these problems. My doctor tried to be supportive and helpful. After 3 weeks of crying, he suggested that we try drops for wind. After a month, he suggested that we try changing the formula. A few appointments later, he said that we should be weaning off the formula as we went on to a new one. 6 formulas later, and after buying every bottle on the market, I was told that she must have acid reflux, and I was given 2 kinds of medication. First Zantac, then Losec, that I was supposed to give her every few hours. But she was still crying. The tension would build in my body when she would scream. I wanted and needed to make her better. After countless reasons and excuses from different doctors as to the reason for the constant crying, they were now under the assumption that my 4-month-old daughter may have a urinary tract infection. Not knowing what else to do, I agreed to let them perform the test needed. I can't tell you how horrifying it was watching a 4-month-old baby screaming in pain as the nurse inserted the catheter. We later found out that the results were negative. She did not have a UTI, and that too was not the cause of her screaming. No one ever told me that this crying was normal, nor that it would come to an end, nor did they talk to me about how I was dealing with the stress and the frustration of it all. I don't think that's an unusual situation at all. And again, to stress the role of the medical fraternity, the support structures around you in sometimes perpetuating your concerns. But I think it's also really important to understand that as parents, we will sometimes drive those concerns, because if we revisit our doctor on a daily basis, on a weekly basis, asking the same questions about why our baby's unsettled, ultimately it's going to prompt a raft of testing. There are some red flags. Not every baby is not going to have problems. And I think it's really important to know that certain indications should make you go to the doctor. Obviously, a baby with a fever shouldn't be managed at home. A baby who's not gaining weight, and a baby who's feeding poorly. But let's balance that out and look at what are the reassuring signs. And obviously, converse to what I've just mentioned, good weight gain and a baby feeding well. A baby who settles when they cuddled, and a baby who is achieving their developmental milestones. I think these are really important because I can tell you in my practice, the large majority of patients that I see who come in with an unsettled baby don't have a baby who has something wrong. And in fact, I can tell you that the most common comment I make when I see patients is the symptoms that they're complaining about with their baby are just normal. So as you embark on what's obviously a very exciting chapter of your life, I think it's important to make sure that you go forward in all of this with a very glass half full approach to how things are going to go. It is a fantastic time, but at the same time, it's a difficult time. It's a time where you're going to be exhausted, where you're going to be stressed, where you're going to feel the weight of responsibility on your shoulders like you've never felt before. But please make sure you allow yourself to be reassured by those signs which tell you your baby is in fact doing well, even though at times your baby might sound like they're complaining a lot. Thank you.
Thank you, Neil, for that information. Now I would like to talk to you about the SAN Swaddle program. This is a unique thing at the SAN. It's really one of the first programs like it in Australia, where women can access first-class private obstetric care for zero out-of-pocket costs. What does that mean in reality? So firstly, just the history of this, you've basically got a not-for-profit hospital, the Sydney Venice Hospital, with a not-for-profit health fund, HCF, combining forces to bring this great package and make it available to the women that qualify for it. How do we know if you qualify or not? Well, basically you need to have sat your 12-month or waited your 12-month waiting period. Now, sometimes if you're just, say you took out health insurance 6 months ago and then you find yourself pregnant and your due date is well after the 12-month waiting period, then you would most likely qualify. There is information about that on a new website called sanswaddle.com.au, but also just the normal SAN website and HCF have all this information available to you. What the program covers is all of your standard obstetric costs, so your costs with all your obstetricians for antenatal costs and the delivery costs and your postnatal costs, as well as all your ultrasounds and pathology costs. That's all covered in the program. And should you need an anaesthetist, then their costs are also covered, as well as the paediatricians. So it does seem to be too good to be true, but it is actually as it is. And it's come about because of this unique relationship between the SAN and HCF. It's some people think of it as being a cheap alternative to normal obstetric care, and I just want to make sure you're aware that it's not that it's a cheap alternative, it's just an excellent alternative, because we are still being looked after quite well. The HCF are basically increasing their return funds to the hospital to allow to cover the extra costs. So you're still getting the choice of your own private obstetrician. There's a list of the obstetricians that participate in that on the website. And it's just as if you were having a normal pregnancy. Even if you have a high-risk pregnancy, say twins, or you've got problems with diabetes or other situations, all those normal costs are covered. The only thing that might not be covered is if you do need the attendance of another physician, such as an endocrinologist or kidney specialist, or should you unfortunately have intensive care, there may not be some, there may be some out-of-pocket costs there. But all the normal pregnancy costs are covered. So we would just like to encourage you to have a look at that. And if you're not sure whether you qualify or not, you can contact HCF and they can give you all the information. And some of my patients who were not necessarily in HCF when they started, they contacted HCF to see whether they could actually, because they were in another health fund, they then contacted HCF to see if they were covered, and you can seek that information from HCF directly.
We've just starting our question and answer session, and I noticed that a number of you are using the chat line to issue your questions, but can I ask you to please post your questions in the Q&A section there. But before we start, I'd just like to introduce you to one of our other people who are attending now. It's Dr. Katja Zuberin, who is a clinical psychiatrist who's at the SAN here, who has a lot of experience in perinatal mental health, and she brings a lot of experience with her there. And we, as Neil has mentioned, as well as most of us obstetricians have experienced, there is a lot of perinatal mental health issues going about, and Katja is an excellent resource there that you can ask to see if needed. A couple of just bits of housekeeping we need to let you know about it. At the end, or in your inboxes by the end of this webinar, you'll have received a little survey just going over some questions. We really appreciate if you could fill it out. This helps us to improve our webinars for the future, and just lets us know if it's been helpful to you. And the last thing is that also an email will come to your inbox sometime in the next few weeks, or maybe even sooner, with basically a basic maternity info pack, just with some general information about the maternity service here at the SAN. So now I'm just going to go through some of the questions, and we'll start from the top. They're all pretty straightforward. Some of them I'll answer, some of them I'll direct to some of the other doctors, and we'll just basically go through. So please, if you want to ask questions, please put them in the Q&A panel. If you can't find that on the bottom of the Zoom screen, there's a Q&A section. Press that box so you can see all the question and answers, and you can ask your questions there. So the first question, which I thought was quite good, which I did cover in my Swaddle section, but I'll just go over it again, is the question was, for the Swaddle package, regarding your private health cover and waiting periods, do you have to have met the 12 months waiting period before you even have your initial consultation, or just met the 12-month waiting period by the time the baby's born? In summary, you need to have completed your 12-month waiting period 4 weeks before your baby is due. So if your baby is due on the 30th of September, so on approximately the 1st of September, you need to have completed your 12-month waiting period. So you don't have to have completed it before you enter the program. If you're like 4 months into the program, then find you're pregnant and your due date is 4 weeks after your 12-month expiry period or waiting period's up, then you qualify. I hope that makes sense. I had an interesting question here, which I thought was quite a good one. Is there any additional cost for partners staying for the 5 nights and for the 5 days in hospital? So as a general rule, if you have a baby born by a normal birth, it's a 4-night stay, and if it's a cesarean section, it's a 5-night stay. And and your partner is welcome to stay for any of those nights. There's no additional cost. Some of the rooms have got double beds, some of the rooms are single beds, and there's a long couch which they can stay on. The only thing is that their meals are not provided for their partner, but they're welcome to stay. Now, a lot of these questions I can just answer quickly, so I'm just going through. There will be questions for other people. Another question: are classes and Well Baby Nursery open during the COVID period? And the answer is the classes in the hospital are open, and the Well Baby Nursery is open, but not the antenatal classes that are happening are not open, which is why we have the Nourish program. Okay, I'm going to direct this one to Ellie Bailey. As a mum with gestational diabetes, will I be allowed to perform skin-to-skin and breastfeeding before my baby gets taken for a BSL test? Go ahead, Ellie.
Absolutely. The first thing, if your baby's well, when it's born, whether it's a natural birth or whether it's a cesarean section, the baby comes straight to your chest for skin to skin. That's our #1 priority for all of our happy, healthy babies. The breastfeed within the first hour is an absolute paramount importance to us, and we absolutely prioritise doing that. The blood sugars will be done, but skin to skin and breastfeeding come before that if your baby's well and you're growing well.
Thanks, Ellie. The next question is on Director Neil Ginsberg, and is a baby check done by a consultant paediatrician? Go ahead, Neil.
Thanks, Peter. Yes, most certainly the baby check is done by a consultant paediatrician. Most days your paediatrician will pop in as well, in addition to that initial check, to see your baby, and then a second comprehensive check is done just prior to your baby's discharge. And that's obviously in a well baby situation. If your baby needs to go to special care for any reason, then obviously more intensive caring for your baby and careful assessment every day occurs in special care.
Great. Okay, I'd like to direct this one to Melissa. When should we start our Nourish baby classes?
As soon as you like, as soon as possible, really. We have information in there from the very beginning of pregnancy, so it's never too early, is the short answer.
That's fair enough. Okay, I mean, that's good. Another couple other questions here. Might direct this to Ellie. It's kind of a bit vague, but I'm sure you'll be able to cope. What should we look for when choosing an obstetrician, and how do we narrow down from so many qualified specialists? And at the SAN, we do have a lot of excellent qualified specialists. So, Ellie, how do you answer that one?
That's a really good question. And it is hard, because I can hand on heart say that all the obstetricians at the SAN are brilliant. They're all superb. Everyone is slightly different personalities, of course, because we're all different people and trained at different places. I think people often will choose obstetricians that their friends might have used, or people from mother's group, or often the recommendation may come from the GP. You may have a great relationship with your GP, and they may have someone that they particularly like to refer to, and because they've had good experiences and good communication with that obstetrician. So certainly ask around. You can do some research online as well, of course. And then what most people do is decide on one and then have their first meeting. And often that first appointment is a bit longer, and you can really get a gist of whether you gel together. So it's really important that you feel that you will be a good mix, because it's going to be a 30-week relationship, and so you want to make sure that they're the right sort of personality for you. And obviously if you think that they're not, then there's other options, and you're very welcome to see another specialist if you want to on the Swaddle program. But how do you pick? I don't know. Ask around, and you won't go wrong with anyone at the SAN.
Thanks, Ellie. Interesting question here. Is it true that OBs who are participating in the Swaddle program have a limited number of patients they can refer to? in summary, no, most of the obstetricians at the SAN don't limit their numbers, so any number of patients can come under their care. They don't have a quota of X number of swaddle patients only, and if you don't get in, you're bad luck. That's not the case. Feel free to call any obstetrician and ask them. They'll tell you, but there's no limit. Let's see, I'll leave that one here. That's pretty much the same question as before. There's a question here. If the baby, this is for Neil Ginsberg, if the baby is unwell and can't stay in the special care, where will they be transferred? Over to you, Neil.
Thank you. Good question, and question that does come up quite often. Obviously, it's always our intention to keep babies as close as possible to their mums, but circumstances arise where it's necessary for us to transfer that baby out to a high level of care hospital, where there's a neonatal intensive care. We will always do that at a point where we are ensuring the absolute safety of the baby. So we try our best to keep babies at the SAN, but we'll never compromise that baby's safety, and that'll obviously be explained to parents at the time. Where do we transfer them to? We will always choose the hospital that is most geographically suited to that family. So we'll look at your address and pick the NICU hospital that's closest to where you live. Perchance your baby has to be there for a lengthy period of time. Unfortunately, though, it's not always within our control. It's dependent on beds and bed numbers at the receiving hospital. And it's also dependent on what the problem is with your baby. So, for example, certain babies who require a surgical procedure done early on, that can only be done at certain hospitals, in particular Children's Hospital at Westmead or Sydney Children's Hospital in Randwick. So that sometimes dictates our choice, but we will always do it to the best of our ability at somewhere that's going to be convenient to you, as I said, within the confines of bed availability and speciality appropriate referral.
Thanks, Neil. Next question. Are all the in-hospital classes like breastfeeding, baby care, etc. covered by your health? And yes, they're all covered, so that's straightforward. And all the paediatrician visits, I mean, they're covered even if you're not in the Swaddle program, they're just covered. Once you're in the hospital having your baby, those classes are covered, the ones that are in hospital. And paediatricians and the like while in hospital, well, all the paediatrician visits are covered by the Swaddle program, but if you're not in Swaddle, the paediatrician costs, you will receive an invoice for that, and some of which is covered by Medicare and your health fund. Now, question about Swaddle. I love talking about Swaddle, so I'll talk those questions. Can you join the Swaddle program at any time during the pregnancy? Yes is the answer. I mean, you need to have sat your 12-month waiting period, and if you're not in HCF, then you need to talk to HCF to see if you qualify, because that's a question you can ask directly to HCF if you've already sat your 12-month waiting period with another health fund. Question from Ellie. Thanks, Ellie, for your question. Are the ultrasound covered? Just the ones with the obstetrician or the ultrasounds? Basically, I'm just reading the question at the same time as answering it, which is a bit rude, sorry. All the ultrasounds that are performed with this, there's a group called the Ultrasound Care Group, of which the SAN Ultrasound for Women is a member of that group, and all of the ultrasounds that are done in those institutions are covered in the Swaddle program if you're in the Swaddle program, not just the scans that are done with your obstetrician. The good thing about the Ultrasound Care Group is that is a tertiary level group. You've got specialist obstetricians who are specially trained in fetal medicine and diagnostic ultrasound, who are looking after you, so you're getting a first-class service, and a lot of those doctors also work at universities as well, teaching other doctors, so very good service. Now, question about Swaddle again. If my OB is on the list of Swaddle providers, can I swap into the Swaddle program? And that's a question for your OB directly, so you can raise it with your OB directly.
But almost certainly, yes.
Yeah, that's right. Most of the obstetricians who are part of the program, well, all of them would say yes to that. Now, there's a question here about consultation with a lactation consultant, and if you want to have a consultation with a lactation consultant, you certainly can. You'll no doubt have been given a brochure. I just should show you. Hang on, get one quickly. When you book in, you get one of these little brochures. I've got in my office, but I'm just getting for you now to show you. you get one of these brochures like this, and then there's a lot of information and also common information, but on the back there is some numbers to help you, and there's a number there for antenatal bookings, and you can also book in to see a lactation consultant prior to if you think you may have some issues like previous surgery or if you've had previous breastfeeding problems. Now, there's a question about if we are with HCF, when do you pay your excess? And that is when you are admitted to the hospital. So when you go in to have your baby, you won't be charged at the door. What generally happens is you have your baby, and then a couple of days later, your husband goes down to admissions and pays your excess then. That's generally when it's done, and it seems to be pretty straightforward. Now, let's see, another question. Sorry, they're coming in thick and fast. We may have to wrap this up pretty soon, but thank you so much everyone for attending. There has been a question that people have been asking about, is this webinar going to be available to view at another stage? And I believe it's going to be posted on the SAN website, which you can link to later on. That will take a few days to get organised. So if you want to refer back to it, you should be able to get the information from there. There's a question about epidurals. That's a good question. Basically, epidurals are inserted by anaesthetists, and if you're part of the Swaddle program, then yes, the anaesthetic costs are covered. So if that, so I hope that answers your question there. All right, Ellie, I'll give this one to you. What about dads who want to do skin to skin after or upon birth?
Totally fine. So we've got lots of dads who want to do skin to skin, and some mums might prefer that if they, for example, are getting some stitches done after they've just given birth and they are concentrating on that. Absolutely fine. Dads get their shirts off and get babies on their chest, and often might even put their shirt back on and hide their baby kangaroo care underneath their shirt. Totally fine. We are very, very pro skin to skin. We know the importance of it, and we'll support patients and their partners to get skin to skin straight away.
Okay, another question for you, Ellie, as well. If my wife is due in January 2021, how soon can we book in a maternity ward? I'm not sure what they mean by that, but how soon should they book in to see their obstetrician?
So book in. So someone else said earlier as well, what's the steps to book in? So the usual steps when you find out you're pregnant, so once you've peed on the stick and you've got 2 lines, is most people then would go to the GP and have their pregnancy confirmed. Then you have a chat with your GP and do your own research and decide which obstetrician you want to see. And on the SAN website, you can see the list of obstetricians who are taking part in Swaddle. Once you have picked an obstetrician, you then give their rooms a phone call and book in your first appointment. Most people would come for their first appointment with their obstetrician somewhere between 8 and 10 weeks, something like that. You might go a bit earlier if you've got bleeding or a history of a miscarriage or something like that, but you'd normally go about 8 to 10 weeks. You need a referral from your GP, and once there you get your blood test done and an ultrasound done to confirm your pregnancy, if your GP hasn't done it already. So yeah, that's what you would normally do. And then booking into the hospital is a process done once you've met your obstetrician and once you've had your first appointment. It's just an online process of registering yourself with the hospital, but you don't need to do that before you see the obstetrician, and we will explain to you how that process works.
There's been a few questions about specific sort of medical conditions during your pregnancy, etc., which I might not answer this time. This is not really the nature of this talk, but feel free to contact one of us if you need to, and we can talk to you specifically about that. Let's see. What is the SAN's perspective on caesarean sections? Do you prioritise natural birth as much as possible? How often do you perform caesarean sections? Well, I'll just answer that as a general rule, and that it's up to each of the individual obstetricians and their particular practices. The SAN doesn't have a particular quota or a percentage that they try and adhere to. There are certainly some obstetricians who have lower caesarean section rates and some who have higher caesarean section rates, and don't be afraid to ask your consultant as to what their priorities are. So that's very much up to the individual. It's not really a SAN-based thing, but more of a consultant-based thing. So hope that clears that question up. Let's have a look here, sorry. I think we're pretty much close to the end here. I'm just having a quick look at any last questions. Hang on. There's a question here from somebody named Emma. I live about 30-40 minutes away from the SAN. Will this be an issue? And are there obstetricians that do appointments at other private hospitals that could be closer to me? Emma, I'll leave that one to Ellie. It seems like Ellie, it's a bit of an Ellie Peter show, but go for it, Ellie. Answer that one for us.
So we do now that we've started the Swaddle program, we are finding we're getting patients coming from further afield. I delivered a lady last week who lives in Wollongong who came all the way to the SAN for Swaddle. I've got lots coming from the Central Coast and the Northern Beaches, so you wouldn't be on your own coming a bit further. So don't stress about that, and we talk about that during your appointments and how we're going to cope when you're in labour, etc. As far as your appointments need to happen at your obstetrician's rooms, and I think all of us only have rooms here at the SAN. None of us have rooms further afield, so unfortunately you would have to travel for all of your appointments. There's only normally about 10 appointments for a straightforward pregnancy, so you'd have about 10 visits or so to plan for. And yeah, between appointments you can always do things on the phone if you have any queries without having to necessarily drive all the way down.
Okay, there's been a couple of questions about mothers groups and does the SAN organise them, and at this stage SAN does not organise them because we like to encourage the use of the community health childhood healthcare. I might let Neil talk about that, our interaction with the childhood, the early childhood nurses. Neil, do you want to talk about that?
So that's correct. The mothers groups are arranged by the early childhood community nurses following your attendance there after your baby's born. We certainly have access to our lactation consultants after your baby's born if you have problems and need some assistance with your baby and feeding. But in terms of arranging mothers groups, that happens from the community. And then a question, if I might just jump onto another one that came allied to that, was is there such a thing as fathers groups, and does the SAN organise fathers groups? So officially, so the SAN doesn't, no, and officially there are no fathers groups as far as I'm aware, but unofficially I think lots of fathers do organise groups with the fathers from their partners' mothers groups. But no official fathers groups is a short answer.
All right, thanks, Neil. Lots of questions about Swaddle, and if you've got any questions about Swaddle, please don't hesitate to go onto the SAN website. But another question, how do you join the Swaddle program? And simply, you've just got to ask your obstetrician. You need to be in HCF and ask the obstetrician. If you're not sure if your obstetrician's covered, go on to, as part of the Swaddle program, go onto the SAN website. You can see the list of obstetricians there who are part of the program. Let's have a look
if
here.
you bring up the receptionist for the obstetricians, they're all very used to answering questions on Swaddle now, because that's about 50% of our phone calls. So please, if you've found an obstetrician that you like the look of, give their receptionist a call, talk to them about how you join Swaddle. They will be able to tell you exactly what to do.
Excellent, thank you. We're getting pretty close to our wrap-up time here, so I might just answer two more questions, just trying to pick ones that are really good. Let's see here, the one here. Sorry, there's so many questions, I've just got to pick up this one. Do all my appointments with my OBGY need to take place at the SAN for them to be covered under the program? And the answer is no. Most of the obstetricians who are part of the Swaddle program do not have rooms at the SAN, they have them in other locations. Some have them at the SAN and other locations. It's really up to that particular obstetrician. But you have to, but the qualifying thing is they need to be an obstetrician at the SAN, as is the list will say, and you need to deliver your baby at the SAN, and you need to be in HCF. That's probably been stated a lot of times now.
One of the questions is, do any of the private obstetricians also work in the public hospital? Yes, several of them do, but if you want to take part in Swaddle, then you need to have your baby at the SAN private hospital.
And the last question I'll take away, is the first appointment with the obstetrician covered by the Swaddle program? And the answer is it depends. If you are already in HCF and will definitely be covered by that program, and your 12-month waiting period will be covered, then yes, it will be. But if you're not an HCF at that point, then the answer is no, it will not be covered by the Swaddle program. But if you change to HCF later on, then appointments from that point on will be covered. Well, we might draw it to a close now. Just a reminder that there's a survey coming up, or you've probably already got it in your email inbox already. And that's just to give us an idea of what you thought of the webinar, and if you can give us some feedback as to how we can improve it in the future. And also in your email, there will be a maternity info pack, which will be emailed to you, which has got lots of this information for you, and places to start, if you've got questions, at least a starting point. Thank you very much for attending. It's been really exciting. In fact, at one point we had at least 100 or so people attending, which is really fantastic. We really thank you all for coming, and hopefully we may see some of you in the near future.